So we had two excellent presentations on the overview of treatment, like can we cure CLL? If yes, is there any chance for curing the disease later than in frontline? And the answer Jennifer Woyak gave here was no. Probably when we really want to cure the disease, we have to administer our best treatment in the frontline regimen. And she also raised the question, for example, with cellular treatments as CAR T cells, which are not approved in Europe but in the US, does it really make sense to give them as a last line regimen when we know maybe this is a potential curative treatment, at least in a small minority of the patients? And what Nitin Jain also evaluated was which patient is suitable for which type of treatment. So the question on continuous treatment versus time-limited treatment and the different choices we have on time-limited treatment. And I think there is, with more studies coming up, a more and more consensus that probably the continuous treatment are better suitable for either very high-risk CLL with TP53 separation, or also elderly frail patients for whom it's just difficult to do a ramp-up with the BCL2 inhibitor. However, we have to wait for the CL17 data in order to have here a final answer with respect also to different time-limited treatments.